Hello, everyone, and welcome. My name is Nadje Al-Ali, and I'm a fellow at the Watson as the Robert Family Professor of International Studies and Professor of Anthropology and Middle East Studies. And I recently joined Brown in January of 2019. And I'm really, really happy to be able to welcome to you Professor Alfredo Filho, who was my colleague at my former university, that is SOAS University of London. Alfredo Saad Filho is Professor of Political Economy and International Development at King's College London now. Previously, this is where we were colleagues, he was Professor of Political Economy at SOAS University of London. Professor Filho was also Senior Economic Affairs Officer at the United Nations Conference on Trade and Development. He has published extensively on the political economy of development, industrial policy, neoliberalism, democracy, alternative economic policies, particularly in relation to Latin American political and economic development. He's also written on inflation and stabilization and the labor theory of value and its application. And over the years, I've read quite a bit on Professor Filho's writings on neoliberalism. And I thought it would be really interesting to have a conversation with him, given that it's becoming apparent that the effects of COVID-19 have been, of course, that there's a long history of inequalities that were created and accentuated by neoliberal policies. And one of the things that I really like about being at the Watson is that it's bringing together people of different disciplinary backgrounds and also with different empirical background. And I thought this would be a good way to have an interesting discussion with people, who come from very different backgrounds in terms of our expertise. I'm an anthropologist working on gender in the Middle East, and Professor Filho is a political economist. And I'm going to refer to you as Alfredo because we know each other. So, Alfredo, I thought that, before talking about specifically the effects of neoliberalism on the current situation, or, how the effects of neoliberalism are playing out, it would be really useful if you could provide us with a brief working definition of neoliberalism. I know you've written extensively on it, and I think it's difficult to put it in a nutshell, but I know that we use the term, all of us use the term, but we're not always so sure what we mean. And sometimes I have the feeling that we might mean slightly different things. So could you provide us with a brief working definition?
Thank you so much, Nadje. It's really nice to be able to talk to you today and to talk to the audience of the Watson Institute. Neoliberalism, I think, is the background of this economic, social, political, and health crisis that we are living through at the moment. Now, neoliberalism has been interpreted in the literature in many different ways by a very large number of contributors. Clearly, there is a perception that neoliberalism, the term neoliberalism, reflects something important about the world in which we live, about the times that we are living at the moment and over the past few decades. And there are different ways to look at it, not necessarily right or wrong, but different angles from which you can appreciate the problematic of neoliberalism. One is to look at it from the point of view of the history of ideas. Neoliberalism as a set of ideas and understandings of the world inspired by Austrian political economy, Mises and Hayek and their disciples, and a synthesis with the monetarism of the economists associated with Milton Friedman and the tradition of the Department of Economics of the University of Chicago. So a kind of a libertarian Austrian perspective fused with a traditional neoclassical economics view that comes into a set of policy prescriptions, ideas and policy prescriptions that inspires our age. Clearly, this is relevant. Margaret Thatcher, for example, was very fond of Hayek, and they had conversations, and he was an informal advisor, and clearly ideas matter to inspire policies and so that people see the world in particular ways. That's one way to look at neoliberalism. Another way to look at it is as a set of policies, a set of institutions built around policies and to implement policies, and around a set of practices of government. And then we have neoliberal governments, starting perhaps with Chile under General Pinochet, or in a more contemporary vein, Ronald Reagan in the United States, of course, Margaret Thatcher in the United Kingdom, and then a proliferation of administrations inspired by similar views of the role of government and the role of policy around the world. And to the extent that neoliberalism has become dominant in terms of policy making in the world in which we live, and it has been dominant for a few decades now. Another way to look at neoliberalism, and you will also find this in the literature, particularly in the literature coming from the left, the critical literature, is to see neoliberalism as a stage or a form of class conflict. The deliberate rollback of the working class and the conquests of the working class and the political influence and organization of the working class by the right. And Margaret Thatcher, again, was very clear about this. She explicitly said that her government was about rebalancing, she called it rebalancing industrial relations, which means in practice, break up trade unions, introduce very restrictive legislation against industrial action, etc., similar in the United States, similar in other parts of the world as well. So you can look at neoliberalism as this offensive by capital against the workers, by offensive by the attack by the rich against the poor. It's very easy to defend this point of view. Or you could adopt another point of view that is also one in the literature, is the one that I happen to be more sympathetic to. But neoliberalism is a phase of capitalism. It's a mode of existence of capitalism. It's a form of existence of capitalism today. It's the dominant form of existence of capitalism. We had capitalism in the kind of classical liberal form before the First World War. We had capitalism in the Keynesian stroke social democratic form in the post-war period until the 1970s, and that collapsed. And now, since the late 70s, early 80s, we have the phase of capitalism that is dominated by neoliberalism. Now, neoliberalism itself changes, but it has common features. And from this point of view, neoliberalism is a phase of capitalism that is determined by financialization. The financialization of production, exchange, human interaction, the financialization of social reproduction is the dominant feature of the moment in time that we're living. And that affects ideology, it affects forms of government, it affects everything else. So these understandings of neoliberalism, they're not incompatible, but they highlight different aspects of this phenomenon. And they're all legitimate, and they can contribute to a richer perception that we are living in an exceptional moment in time that has its own features. And as we're going to get to today, it has particular vulnerabilities as well.
Yeah, this was really helpful. And before we're going to delve more into the vulnerabilities and the relation to COVID-19, just wanted to add to what you're saying. So in my world, in relation to feminism and sort of gendered inequalities, the way that neoliberalism has come up, first of all, it has come up often in conjunction with neoconservative policies and sort of the idea, very specific ideas of women's empowerment, often linked to sort of narrow definitions in terms of women's leadership or women as business people. And so in the context of the Middle East, often the neoliberal / neoconservative interventions were very sort of rights-based, quotas, women in leadership positions, privatization of economies in which women often were disproportionately affected, because historically women, certainly in the Middle East, but I know in many other parts of the world, have played a large role in the public sector. And in the Iraqi context, after the invasion of Iraq in 2003, we talked a lot about neoliberalism and neoconservatism in the way that the US saw women and sort of gender relations. So just wanted to add to that. But let's now focus a bit on, so why does the question, why does neoliberalism matter when we're trying to understand the unfolding effects and consequences of this current pandemic we are living?
It matters in many different ways. It matters because neoliberalism has structured a global food production system that is very vulnerable to disruption and to the emergence of new diseases. It matters because neoliberalism has globalized production chains, these production chains that today have become so deeply disrupted by the pandemic and by the closure of borders. Neoliberalism matters because we can all see travel has become almost impossible these days, and that creates huge disruption to our lives and our lifestyles. But beyond these kind of self-evident ways in which the moment in which we live connects to the pandemic, and the ways in which the pandemic belongs specifically to this historical moment, there are other ways in which neoliberalism, or the analysis of neoliberalism, matters to us. The pandemic emerged in a particular circumstance, not by chance, but it emerged at a moment when the world economy was 10 years past the global financial crisis that started in 2007 and struggling still to emerge from that crisis. So we had a fragile world economy where the strongest economy, the United States, was already skidding with widespread perceptions that even the US economy, that was the best performing large economy in the world, in the West, was not going to be able to maintain its rhythm of growth. In parallel with this prolonged economic crisis, and I would argue economic decline of the West over the past several decades, particularly since 2008, you have an emerging political crisis as well. The crisis of democracy, the crisis of the model of democracy that has been associated with neoliberalism, and the emergence of political authoritarianism and the emergence of spectacular leaders in a number of countries in the world, people who achieved positions of power by force of personality, by claims of business acumen, Donald Trump being a particular example, or by sheer demonstrations of or claims of being outsiders, barging into the political system and trying to reorganize their societies. Jair Bolsonaro in Brazil being one example, or Rodrigo Duterte in the Philippines being another example, or leaders that come at the head of parties and movements that seek to reorganize their societies in particular ways. Modi in India, Erdogan in Turkey, and in a number of countries in Eastern Europe as well. So we have a systemic political development there. And on top of the economic crisis, and on top of these political developments that reflect the political crisis, you have this enormous impact of the pandemic. And then you end up with an economic system that is creaking, and now in the deepest economic contraction in the history of capitalism, and a political system that is bereft of the holds of strong institutions, strong mechanisms of representation, and in the states most deeply affected by the crisis, a political system that is submerging into a deeper crisis than was the case before. And in some cases, the US and the UK in particular, but also Brazil, demonstrate a political system that demonstrates a staggering inability to protect the right to life of their populations. And that is really deeply shocking.
Yeah. So, I would like to discuss with you the specific inequalities that neoliberalism, if not caused, but contributed to, and that come to the forefront now. But before doing that, I'd like to go back a bit in history and look to 2008. I don't want to go into too much detail because for those of you who haven't yet watched the excellent, very informative and important conversation between director of the Watson Institute, Professor Edward Steinfeld, and the professor of economics, Mark Blythe, who talked in great detail about the economic effects, including the sort of difference to the 2008 economic crisis. I don't want to go over that. I refer you to this conversation. But I'd like to discuss with you the sort of difference in terms of now the reaction to that crisis and the current situation. Because for someone who is a layperson like myself, it seems to me very puzzling that at the time what we got as a result is austerity. And I guess I'm mentioning that because I feel that what we're experiencing now and the inequalities are also a result of austerity. And I guess that is an aspect of neoliberal economics. And at the time, in so many different contexts, we have been told, okay, we need to cut this, we need to cut in terms of healthcare, we need to cut in terms of social welfare provisions, across the board, education, you name it. But now we are being told, okay, we generate, packages to support people here and there. I mean, there might still not be, they're not clearly sufficient, but where does this money come from now? How is it possible that we do it now and we were not able to do it then? So this is a very naive layperson's question.
No, this is not naive at all. This goes right to the core of the policy problem of neoliberalism and the ideological limitations of neoliberalism. The crisis of 2007 was a crisis of financialization, was a crisis of overproduction of financial assets that was resolved through massive government intervention to salvage the banks, primarily to salvage the financial system through operations of central banks around the world and through quantitative easing in particular. That worked in the sense of salvaging finance, so demonstrating once again that neoliberalism at its core is about financialization. The financial institutions were saved, but economies did not resume their trajectory of growth. There has not been sustained growth in the advanced Western economies for a very long time, and decade on decade, you can observe rates of GDP growth and rates of investment have tended to decline. It's not the same around the world, but clearly it is the case in the advanced economies in the West. So these economies are already fragile, and you come out of the crisis with a significant fiscal deficit and very large levels of domestic public debt. And the solution, as you indicated, has been to claim that this debt has to be paid for, that governments are just like households, they cannot spend more than they earn, and so austerity spending cuts are necessary. Now, this is false at a number of levels. It is false, first of all, because even if governments were just like households and couldn't spend more than they earn, they could tax more. And if you target in particular the highest earners in society, and it is widely known, and certainly since the work of Thomas Piketty in his very famous book, justifiably famous book, Capital, that came out a few years ago, became a big hit, but then the work of so many others around issues of distribution has been demonstrated, abundantly demonstrated, that the rich no longer pay taxes. One of the great achievements of the post-war consensus in the West, that it was important to build welfare states and achieve a measure of redistribution, that has been reversed by neoliberalism. So you come to a situation where only the poor must be forced to pay, and the way to force them to pay is primarily through compression of wages and the rollback of the welfare state, and that has been imposed in a number of countries. Now we hit this new crisis through the pandemic with a limitation, and the limitation is governments stepped in immediately and they started pumping up immense, incalculable still amounts of money to stabilize economies that are no longer working. So the bill is potentially unlimited. and this will have to be paid for in some way in the future. Now, this is the argument. So almost naturally, now the neoliberal ideologues will come back and say a new round of austerity is sadly needed. I am hopeful that this will not pass this time. I am hopeful that the shock of the pandemic, I'm hopeful that the size of the gap to be filled, and I am hopeful that the evidence that we are living in a society in which we deserve and demand mutual protection, and that has to be built on the basis of public services and the provision of public goods, that will be sufficient to tilt the debate towards, yes, this time the rich have to pay. Yes, this time progressive taxation will help to stabilize those societies. Yes, this time we can see very clearly that simply cutting down on public services makes the poor vulnerable, but it makes the entire society fray at the edges and makes it vulnerable even to health problems, not to speak of everything else. So I'm hoping that the debate has shifted. But what the pandemic has also demonstrated, and you pointed to it very, very clearly and correctly, is that governments can create money out of nowhere. Governments are not like households that must earn money before they can spend it, that have to have a savings account from which they draw money that if they want to spend more than they earn, and if they spend too much, they run out of savings and they are financially bankrupt. This is not true for governments, for the simple reason that governments print the currency. And if the economy is operating below capacity, this is John Maynard Keynes, the famous British economist of the 1930s. If economies are operating below capacity, governments can intervene, they can spend freely more than they collect in taxes, and that will be a benefit to the economy. The economy will grow as a result, tax revenues will increase, and social welfare will improve as well. So the discourse of austerity is essentially, it's not an economic discourse, primarily. It's an ideological discourse to deflect the burden of taxation down to the poor and to deflect the role of government from being the role of stabilizing the economy, stabilizing society, promoting equality, promoting social integration, to a burden of imposing additional costs on the poor to reinforce the program of neoliberalism, of reordering society and to build an entrepreneurial society in which individuals are responsible for their own fate, not the collective. Now, the pandemic shows the limitation of this approach to social life. There is no individual way to resolve the problem of the pandemic. There is no individual entrepreneurialism that can make us invulnerable to a virus. We need public policy, we need public action that costs money, and states can create money. Look at the problem of housing in the UK. You have thousands of people who are homeless living on the streets. With the pandemic, the government edicts that everyone must be housed, and people come out of the streets through public policy. Well, why didn't you do it before? Why don't you keep doing it until there are no problems of homelessness in this country? It's a wealthy economy. Why can't you resolve this problem? And the answer is you don't want to.
Yeah.
You have an ideological commitment not to resolve the problem, and that should change, I hope.
Yeah, well, I hope so too. But I mean, I would argue though, and I, wonder about your opinion that, I mean, neoliberalism is, and alongside austerity are very significant factors shaping the current context, but there are others, right? I mean, the climate crisis is not going away. I mean, I have to say I've lived in London for 24 years, and so I managed to get back from Providence just about a month ago in mid-March, and ever since then I constantly see blue skies. So clearly something is happening, but the climate crisis is acute. Then we have a situation where wars and conflict continue. The UN Secretary General has requested a ceasefire, to be declared in, I think, approximately 30 ongoing armed conflicts across the globe. These are very important variables as well. So I guess what I'm saying, yeah, neoliberalism is important, but it's not the only thing that is shaping the current crisis or the effects of the crisis.
You're absolutely right, of course. The
Yeah.
climate crisis is a major emergency. This year, so far, is the second hottest year on record, and records keep being broken repeatedly. The melting of the ice shelf in Antarctica and the glaciers in Greenland is reaching alarming levels. And the consequences are very difficult for us to gauge because they will be felt for centuries, even if we stopped pumping CO2 into the atmosphere now, which is, of course, impossible to do. Seas would continue to rise for several centuries. We do not control the Earth's weather. We, as a civilization, we're being extraordinarily reckless and irresponsible, pursuing accumulation and consumption boundlessly on a planet that cannot support these ambitions. And I think there are several fractures on this, but one of these fractures that I find very, very interesting is the generational one. Younger people are much more sensitive to the urgency of the problem of climate change than older people. And of course, poorer people will suffer much more than rich people. Poorer countries will suffer much more than rich countries. It is absolutely urgent and imperative that we engage seriously in strategies of climate mitigation and a shift of the energy base of the Earth. If we do not do that, it's irresponsible towards future generations. But the acceleration of the impact of climate change will be felt by ourselves too. So it is very, very urgent that we confront this issue. And it comes on top of the pandemic. Yeah. And since the pandemic came into the scene, the problem of climate change disappeared from public discourse. And this is not right. And we need to focus on both at the same time. These are significant crises that our civilization needs to address. Unfortunately, financialization doesn't help, neoliberalism doesn't help, because they're about the pursuit of profitability, immediate returns at whatever cost and with whatever consequences for the collective. So that does not help at all. And this is another reason why we need to control the impulses of neoliberalism and the financial institutions, and we need to target public policies and retool the state in order to implement policies for the benefit of humanity, for the benefit of our generation and future generations as well. We must do this. It's an imperative for the survival of life on this planet as we know it.
Yeah, no, I very much agree. And also then going back to, the other issue that's very close to my heart, which is war and conflict. And it's because, I've been following the situation in Iraq very closely, and it's very clear that, Iraq has gone through a series of wars and conflicts. I'm really, really worried about the way that the pandemic is going to, affect society and population. And this is against the background of, first of all, we had the Iran-Iraq war during the 80s that very much affected already the healthcare system, but much more drastically, 13 years of the most severe economic sanction system ever imposed on a country from 1919, following the invasion of Kuwait to the invasion of Iraq in 2003. And Iraq, which used to have, an excellent healthcare system, and also, despite it being a terrible, repressive dictatorship, actually had good social welfare provisions in terms of education and so on. That was, very much decimated during the sanctions period. On top of that, you then had the invasion, you had the occupation, you have sectarian tensions, you have, list of a range of different conflicts. And so now we have a situation where, I checked yesterday, the official number was 1,000, just below 1,500 official cases, I think about 82 deaths. But everyone I talk to agrees that this number does not at all reflect, the reality. Of course, that's the case in so many other countries, but here, militias are sheltering or looking after some people. It's the government is totally unable to actually, do their job. Doctors, you have had waves of doctors leaving the country, and the doctors who are present now have, very limited equipment, medication, and so on. So, and this is in Iraq, but I'm, when I'm thinking about Syria and other countries where you also have, large refugee populations. How are people socially distancing there? How do they have access to healthcare? So I feel, we've just really scratched the surface in terms of the effects of the epidemic. I mean, we've seen it unfolding in Europe. I mean, in China, of course, first Europe and now the US, but in many countries, whether it's in the Middle East, Africa, and I think Latin America as well, South Asia, it's just beginning. And so that is really, very worrying. And across the globe, I mean, I read a few days ago that according to the International Labour Organization, prior to the pandemic, over 60% of workers on the planet hold informal jobs. So that is, I think, about 2 billion people or so, mainly in the global south, but of course, increasingly also in the north. And so when you think about that informal jobs and what does that mean, the ability to engage in social distancing, I feel very privileged. I made it back to London. We have a little house with a little garden. We can socially distance, but how many people live in very crowded conditions? In small flats, no access to green spaces. And, again, when I'm thinking about, relatives in Iraq, refugees who are really struggling in terms of, trying to socially distance. So access to water is another issue. I mean, in Iraq, only a small percentage of the population actually has access to clean water. And, so just washing your hands becomes an issue for so many people. So I was wondering, I mean, you have written extensively on Brazil. I mean, there is not a war and conflict, but it's still, a country with sort of specific conditions. And I was wondering if you can tell us a little bit about the situation in Brazil now.
You're absolutely right that the pandemic has hit a very unequal world, and it builds on those inequalities. Even in rich countries, the US, the UK, and other rich countries, the poor suffer much more than the rich. They suffer because they need their jobs, they need their income sources, so they have to expose themselves and go out to work, whereas more privileged people can seek refuge in their yachts, or they can fly out to different parts using their private jets, or they can at least, as most of the middle classes, work from home and then protect themselves. And it doesn't happen for many poor people who are said to be performing essential tasks, but receiving very low pay for that and having their families in precarious and cramped accommodation. That is a shame. The problem becomes much more severe and much more generalized in poor countries. And you illustrated the case of Iraq, and it's a tragedy for which the Western countries hold a degree of responsibility for. In the case of Brazil, it is absolutely bizarre because the policies to deal with the pandemic have been framed by a conflict between the president of the country, who insists that this is just a little flu and there is no significant danger, and it does not justify, or the costs of the pandemic do not justify closing down the economy and do not imply the need for quarantine of the population, and the vast majority of his own government and the justice system, Congress, and of course scientists insisting that if you do not take immediate measures to test, to isolate, and to keep people at home, there will be horrendous consequences in terms of the costs for the health system and for life itself. Brazil has a sophisticated health system. It has built a public health system, a universal system over the past 3 decades, but it is a poor country and the health system is precarious. It is already creaking in specific cities and areas in the country because they do not have enough emergency beds, because they do not have enough ventilators. There's a large number of people dying allegedly because of COVID or in the context of COVID-19, but their deaths are not being registered as being due to the pandemic. It's a country with a degree of disorganization, social disorganization and lack of state capacity that is much more severe than in the advanced economy. So if the Brazilian president continues with his current approach, to which he seems to be committed, that the country must open up, and he will confront state governors and mayors and try to push them to open up the economy, to open up the shops, put people back to work, as opposed to trying to address the problem through testing, through treatment, and through proper funding of the health system. My fear is that this particular virus will become endemic in the country. And until there is a vaccine, an operational vaccine available to the world's population, and this could take many, many months, this virus will just rotate in Brazil and keep culling lives in that country with no end in sight. I fear that the disaster in Brazil will be huge, with immense loss of life and no exit, unless and until a vaccine is finally developed. Brazil does not have the policies or the capacity of China or even Vietnam, a poor country that has had a tremendous success containing this pandemic with very little loss of life through social organization and state capacity. So that is an example, and other countries in the Far East, they provide an example for the West, and in particular an example for Brazil. But Brazil, the political system in Brazil seems determined not to follow those good examples and to allow the loss of life to continue.
Yeah. Yeah, I mean, we see even in the, in rich, developed, supposedly developed countries, we see, terrible policies that have now, horrible effects. So I'm currently in the UK, in London, like you, but I have family in Iraq, but I also have family in Germany where I grew up. And there we see that the government, first of all, acted relatively quickly in terms of establishing a lockdown. And this is against the background of course, a country with a much more robust social welfare system and a good health system. But I think the main difference that I see, the difference why it seems that, that everyone is sort of asking why is the death rate relatively low in Germany. I think it's just below 5,000, and the official number is, I think, about 150,000 cases. But, it's testing, at a much, much higher rate than certainly in the UK. And I think that, it's, again, it doesn't, the question of, is it policy, is it incompetence that countries like the UK or the US, for that matter, are not able to engage in the same policies. I mean, it's not a matter of know-how. Clearly the expertise is there. Theoretically, the resources should have been there. And I also see that in Germany, in terms of the kind of economic packages, I mean, they seem to be, much more thoughtful and sort of nuanced, as opposed to everyone getting a check of $1,200, to really try to help those in need and to help in a way that, small businesses can survive, but also, individuals and families in precarious situations. Yeah, I mean, going back to the UK, I think it was yesterday I read in the Guardian, so London's Mayor Sadiq Khan, I don't know if you saw the article, so he wrote, it was either yesterday or the day before. Well, anyway, he wrote an article about the way that Black, Asian, and ethnic minority populations in the UK are disproportionately affected. And so I think the figure he was giving was that about 14% of the population are of Black, Asian, or ethnic minority background, but they actually make up 1/3 of cases in terms of intensive care and also in terms of death. And we also know that when it comes to the so-called key workers, you know, whether they're nurses, doctors, bus drivers, people working in grocery stores, delivery workers, and so on, disproportionately they are of Black, Asian, and ethnic minority backgrounds. So they are really at the forefront, you know, of well, taking the risk and not being able to socially isolate. They also seem to be at the forefront of dying as a consequence of the well, the virus, but also the bad policies around that. I've been following the news in the States, and very similar, very sad figures where a very, very large percentage, a disproportionately large percentage of people who are dying in New York, but also across the country, are Black, are Hispanic, ethnic minority. And that, I think, says a lot about, you know, the kind of world we live in.
It does. You're absolutely right. It says a lot about inequalities. It says a lot about housing, about patterns of employment, where minority individuals tend to cluster in the lower ranks of the labor market. It says a lot about pre-existing conditions, health conditions as well, and these conditions themselves are related to economic being economically underprivileged. So it is a society of inequalities, and the virus comes and hits against those inequalities and victimizes the weak. You also pointed out, and I think very appropriately, the issue of state capacities. The German state, or in my example before, the Vietnamese state, or the Taiwanese state, or the Chinese state, they have capacities that Western states, particularly the UK, the United States, Brazil, those states do not have. And they don't have because they don't want to have. It's the result of political and institutional developments that have accumulated over time. It's not the issue of not knowing what to do. It's of not having the capacity to do it. So the British state or the US state find themselves not only unable to procure personal protective equipment for their health staff and a sufficient number of tests for the virus, they are even incapable of importing them in sufficient numbers and delivering them to the places where these items are needed. And this is the state that was built by neoliberalism, by financialization, a small state that is very competent at supporting banks and keeping the financial system afloat and competitive, but very bad at supporting life, particularly the life of the most vulnerable, the poorest in those societies that are also the most unequal societies in the West. So you contrast this with Germany, a much more equal society, a society with a much more robust welfare state, with much more progressive taxation, and you can start to see differences. And then on top of this, state capacity and organization and institutions that are geared towards delivering outcomes for the majority of the population in a way that the UK state, a neighboring country, the UK state is just not geared in that way. It is shocking. It is very disappointing, true. And I hope we come out of this pandemic with a decision, a determination to change the way our societies work. Just like in the Second World War in the West, you decide as a society that you will come out with a much more integrated society, a much more equal society, that you will not rebuild the inequalities that existed in the 1920s, in the 1930s. You will build a different kind of society. And I hope this is the lesson from this pandemic. If we can take something positive out of this tragedy, I hope it is this.
Yeah, no, I agree. Of course, the other set of inequalities that I'm very concerned about are gendered inequalities. I mean, COVID-19 is not gender neutral. We know that many more men are dying. I think it's sort of almost double the number. But when we look at the other effects of the pandemic on population, I mean, women are disproportionately affected. Our former colleague at SOAS, the feminist political economist Alessandra Mezzigi, wrote a really interesting article about the crisis of social reproduction that the pandemic really highlights. And so, first of all, we know that women are disproportionately in caring roles. We also know that when it comes to, again, many of the key working positions, nurses, people working in elderly care homes and so on, again, it's mainly women who are taking the risk. We also know that this is really quite devastating, but across the globe, we are having a crisis of domestic violence. We know that stress situations, financial difficulties, alcohol are all triggers for increase in gender-based domestic violence, and this is happening across the globe. And women not being able to go to speak to someone outside the home or to go to a refuge. Then I also understand and read, and it's also from anecdotal sort of experiences, not myself, fortunately, but the kind of division of labor is in terms of juggling productive work and reproductive work in a situation where more women have been in part-time jobs or sort of precarious labor. They tend to pick up now more of the reproductive labor at home and the housework. And so I think in some article someone wrote that this is like the worst impact in terms of the achievements that women made since the 50s are being thrown back. I mean, I guess it will have a much more it won't be evenly distributed, but clearly these are also factors that worry me quite a bit in terms of the gendered implications of COVID-19.
This is, of course, completely right. It's interesting how a pandemic that it has been claimed affects everybody in the same way. Actually, it does not.
No.
It affects people in very, very different ways.
Yeah.
It explores vulnerabilities that existed before. It expands those vulnerabilities. It, as you described, takes the fact, hits a society where women are treated differently compared to men, and pushes and stresses those differences, sometimes to breaking point. Problems of overwork, of loneliness, of dedication to the household, and then suffering violence on top of that. Issues of being involved in the caring professions while also receiving relatively low wages, both in social terms and compared to men in the same professions, in the same careers. All these differences, and then, as we mentioned before, also differences in terms of ethnic background and inheritance and so on. All these differences grow exponentially in terms of their impact, and then they end up curtailing life itself and making people vulnerable in different ways to the life-threatening impact of the pandemic. This is terrible. And it's an indictment of the inequalities that are inbuilt in our societies and that must be addressed. As we come out of this crisis, we must take a hard look at ourselves and decide that we will build a better society, a more equal society in a sustainable economy, one that will be able to confront not only health crises in the future, but also that will be able to address the climate challenge that we mentioned before, and that is an overwhelming danger to the world. It is just not going to go away unless we take drastic action to deal with it.
Yeah, I mean, that is probably a good way to conclude. But before we do that, I guess I'd like to ask you a bit more. So what, in your vision, would ideally be some of these drastic measures? I mean, what could be done? I mean, obviously, there's not one recipe fits all, given the very huge variations across the globe. But when we go back to the idea of the pre-pandemic neoliberal economic and sort of political framework, so what are some of the lessons we should have learned, and how should we do things differently in a post-COVID-19 world?
I think in terms of the societies in which we live, it is essential to restore systems of progressive taxation, to decide that we're going to build more equal societies, and to reinforce the welfare state. We should also recognize the importance of industrial policy and rebuild manufacturing capacity in different parts of the world, particularly the deindustrializing countries in the north and in the south as well, especially in Latin America and in sub-Saharan Africa. With those economic capacities and a better distributional situation for our societies, we would then be able to consider ways, we should also consider ways in which we can build more resilient, more sustainable societies. We need to address the issue of green economies, changing the energy base of society, changing the employment distribution in our societies, and then build societies that can be resilient for the future. We are a generation with enormous capacities and enormous technological potential to satisfy our own needs, but we are also having to deal with some of the most difficult challenges ever to confront humanity on this planet. The climate challenge in particular is an immense challenge that affects the existence of our species on this planet. And if we fail to rise up to this challenge, if we fail to confront it, if we fail to mobilize all our resources and expertise to address this challenge, we as a species will not be around for very long. But in the meantime, at an immediate level, we must build more cohesive societies. We must build societies with better distribution of income and wealth. We must build employment patterns that can satisfy the daily needs of households and individuals. We must be able to provide for our children, and we must be able to use all those resources in terms of the political cohesion that comes from social cohesion to then mobilize our economy to serve the collective and to serve our future, instead of continuing to support unproductive financial activities, rapid profit making, rapid profit taking, and the exploitation and the despoliation of our own environment. This is just not sustainable and not acceptable anymore.
Well, thank you very much, Alfredo, Professor Saad Filho.
Thank you so much, Nadje. It's nice to talk to you.
Very nice to talk to you as well. Okay, bye-bye, everyone.